Hello, everyone. My name is Brian Hoey, and my research project is on integrated care in the American healthcare system. So I'll be starting out with an introduction and basically explaining integrated care and the state of today's American healthcare system. Then I'll be stating the problem and the research gap, and then go into my four main research questions, then what I've learned throughout my literature review, and then move on to my methodology and hypothesis, and finish up with my preliminary findings and concluding with next steps. So, as an introduction, traditionally healthcare systems have operated on a fee for service payment model. And this means that healthcare professionals earn more money by increasing the amount of treatment that their patients receive. So, it's basically incentivizing doctors to treat patients after the fact instead of trying to focus on preventative care. And what this does is it drives up healthcare costs and reduces the effectiveness of long term care. My working definition here of integrated care is the search to connect the healthcare system with other human service systems to improve outcomes. So my two main research gaps are since the term integrated care is a fairly new term and it's not universally used in the healthcare world, there's no concrete universal definition of the term, which makes it a bit harder to be implemented in hospitals. Number two is there's very little information regarding financial benefits caused by integrated care. The number one that I've been able to identify is unplanned readmissions, and as you'll see in a following slide, they're a huge driver of unplanned healthcare costs. So my four main research questions are: does an increase in integration between healthcare systems and human service systems result in better long-term outcomes for patients? Does an increase in integration between healthcare systems and human service systems result in lower overall costs of care? Does an increase in integration between healthcare systems and human service systems result in increased efficiency for hospitals? And what methods are being used by the most successful integrated care systems? So, some things that I've learned in my literature review. Number one is just a quote that I found really interesting. Western health systems are dominated by the paradigm of a disease focused view that neglects the underlying causes of health and well being. And basically, what this means, going back to the original fee for service model, is that by focusing only on treating the disease and neglecting what causes these diseases in the first place, you're only addressing the problem after it's happened instead of addressing the problem before it's even happened, which can lead to both increased quality of life for patients and a huge decrease in costs for hospitals. Number two is within 1 year of being hospitalized, 56.1% of Medicare fee for service patients were rehospitalized, and the costs associated with these rehospitalizations were $17.4 billion. So, as you can see from a previous slide, these rehospitalizations are a huge driver in cost in unplanned healthcare costs. And then number three, widespread changes across an industry that is so integral to daily life, like the healthcare system, are extremely difficult to implement quickly, which means that there will likely have to be some sort of transition plan in place. So my main hypothesis is that there will be a strong relationship between the integration of healthcare systems and human service systems and the quality of care provided. So as integration increases, quality will increase, and as integration decreases, quality will likely decrease. So my independent variable is the integration of healthcare systems with human service systems. My dependent variables are quality of care, efficiency of care, and price of care. Quality of care and efficiency of care will both focus mostly on patient's view, and the price of care will focus more from a hospital standpoint. And then my moderating variable is the income of area serviced by the healthcare system. And I basically want to look into that so that I can identify if more wealthy, affluent communities are seeing better treatment than poor communities. So using secondary Medicare and Medicaid data provided by the United States government, I plan on creating a scale that measures how collaborative a given healthcare system is within human service systems using metrics such as enrollment in a multi-specialty surgical registry. And what a multi-specialty surgical registry is, it's basically a registry that hospitals can enroll in. And what they do in it is they share best practices with other hospitals so that everybody can be on the same page and everybody knows the best ways to cut down on resources or costs. Number two is ability for providers with health information technology to receive laboratory data electronically directly into their systems as discrete searchable data. And number three is the ability to track patients' lab results, tests, and referrals electronically between visits. And using the same secondary Medicare and Medicaid data, I will be creating a scale that measures overall quality of care using metrics such as cleanliness, time it took to complete treatment, communication with healthcare professionals, responsiveness of staff, discharge information, care transition, unplanned readmissions, and overall rating of hospital. And those 8 metrics will be coming from a survey that the Department of Medicare and Medicaid gives to patients who are in their programs after their discharge from hospitals. So my preliminary findings are, according to an HCA HPS survey, which is the survey that I spoke about on the last slide, conducted by the Department of Medicare and Medicaid, assigning overall ratings on a scale of 1 to 10 to hospitals. The top 5 states in the United States are South Dakota, Iowa, Nebraska, Kansas, and Louisiana. And the bottom 5 states and territories in the United States are Washington, D.C., New York, New Jersey, Maryland, and New Mexico. And my next step, so moving on from those lists, I will be looking into individual hospitals in the top and bottom states in the country to identify both the best and worst practices. And what I hope to find through looking into individual hospitals is try to find what works in hospitals in the best states and what isn't working in the worst states, and try to find ways that some of these best states could share practices with these worst states so that everybody could come closer to average or increase. And I also want to look deeper into what patients are looking for when they assess the quality of a hospital, because that will also glean insights to what hospitals need to do to improve the quality of their care. So that is my presentation. Thank you all.